Everyone forgets things sometimes, where we left our keys or the name of an acquaintance. It's a normal part of life. But what happens when that forgetfulness becomes more significant, affecting daily life and independence? These characteristics are often associated with dementia. It is a progressive disease caused by damage to brain cells, specifically the neurons. It leads to a decline in cognitive functions such as memory, thinking, and reasoning to the extent that it interferes with daily activities. As an analogy, think of the brain like a complex city. In dementia, the roads and buildings start to slowly break down, and communication between different areas very difficult.
So, what are the common signs that we should be looking for? The first one is memory loss. Not just forgetting names occasionally, but also forgetting recently learned information or important dates. The second one is you have a difficulty with planning and solving problems. If you are struggling to follow a recipe, manage a budget, or finish familiar tasks, that can also be a major sign. The third one is you have challenges with visual and spatial awareness. If you have trouble judging distances or interpreting images, that can also be a sign. For example, if you have a difficulty in driving or bringing a glass of water. The fourth sign is that you misplace things and you have an ability to retrace your steps. If you're putting a wallet in a freezer and you don't know where that wallet may be, that can also be a major sign.
The specific cause of dementia varies. It can be caused by aging and induced by other neurological disease. As we get older, several changes in the brain increase the chance of developing this condition. One of those changes is when the brain becomes less effective at clearing out unwanted proteins. This protein then starts to build up and cause inflammation. At the same time, the brain's energy-producing parts, also known as the mitochondria, weaken, making brain cells less able to function normally. When these problems add up, communication between brain cells break down, and over time this can lead to damage or loss of the cells. The same process happens in many neurological diseases, one of them being Alzheimer's disease, where abnormal proteins build up in the brain because the brain failed to remove them. These proteins clump together, forming tangles and plaques, which interfere with how brain cells work and communicate.
It is imperative for patients with dementia to consult with a medical professional once they start to show symptoms. There are multiple steps in diagnosing dementia, consisting of checking their medical history, performing medical checkups, tests, as well as brain scanning. Let's break them down one by one, starting from they're checking their medical checkup or medical history. In a medical checkup, a doctor will interview both the patient and closest family member to understand the timeline and nature of memory, thinking, and behavioral changes. This is also done by reviewing the medical history and the medication to rule out drug interaction or other illnesses. Next, it is followed by the physical and neurological exam to check for problems like stroke, Parkinson's disease, and a quick cognitive screening to see if brain are able to function normally. There is a critical step which is blood testing, where it will check for visible causes that mimic dementia, such as vitamin B12 deficiency or thyroid issues. Finally, we're getting to a brain scan or MRI, such as MRI or CT scan, to rule out immediate structural problems like tumors or breathing, and to look for patterns such as brain circuits that suggest a specific type of dementia. By interrogating all these pieces of evidence, the doctor arrived at a accurate diagnosis to begin appropriate treatment.
So how can we help support someone living with dementia? Well, comparison is the most powerful tool in this case. Be patient, don't argue or correct, focus on their feelings, not the facts. Keep it simple, use short sentences, ask one question at a time, maintain your boundaries. Familiar routines create comfort and reduce anxiety and encouragement. Activities like music, art, and exercise can be very beneficial.
Dementia is challenging, but it doesn't define a person. With understanding, support, and empathy, we can help people live well with the condition. Be informed, be patient, and be supportive.